This recorded review will be going over MedSurg 2, Exam 4, Study Outline. This exam has 2 Select All and Apply questions. Check out the blue patient teaching box on page 155, Avoiding and Limiting Exposure to Carcinogens. Sun exposure as a child is a significant risk factor for skin cancer. Pelvic exams should be performed routinely as scheduled to screen for ovarian cancer. See more on page 941. Ferrous gluconate is very similar to ferrous sulfate. The difference is the concentration of iron in the drugs. You should still see and associate the same nursing implications for those 2 drugs. You can read these nursing implications in Table 15.4 on page 290, Evolve Introduction to Pharmacology textbook. Check out the green health promotion box on ovarian cancer signs and symptoms, page 941. Check out risk factors for skin cancer, page 1005. There are numerous questions on risk factors for numerous types of cancers and how to prevent them, especially skin cancer. Transfusion reactions. How as the nurse should you handle them? Check out page 370. How should you prepare for a blood transfusion? Page 368 to 369. Check out table 16.8, page 370. Know the signs and symptoms and nursing actions for an allergic reaction and acute hemolytic reactions. There are numerous questions on those topics. Check out the green health promotion box, signs of throat cancer, page 286. Check out the screening guidelines for colorectal cancer, table 8.4, page 157. The nurse should anticipate the patient having a chest tube after a lobectomy for lung cancer. Look at box 8.5 on page 177, Kubler-Ross's stages of dying. Leuprolide is a medication prescribed for the treatment of advanced stage prostate cancer. Know the signs of endometrial cancer in table 8.3, page 156. Drinking a carbonated beverage before meals can help with nausea for patients undergoing chemotherapy. You can read more on page 173. A Schilling test can be used to diagnose pernicious anemia. Check out table 16.3, the signs and symptoms of severe anemia, page 353. Understand the side effects of chemotherapy. You can see these on page 170 to 171. There's also table 8.7 on page 170. Screening guidelines for breast cancer on page 157, table 8.4. You should use the palm of your hand when performing a breast self-exam. Check out the red nutrition consideration box on page 338. Pay attention to which foods are high in folic acid and high in iron. Ileal conduits can be placed status post bladder cancer. You can see this on page 821. Ileal conduits have a stoma, and those stomas do not need to be catheterized. Reflect back on our TNM cancer staging on page 154 and be able to read a cancer staging such as M0 blank and understand what that means. Pernicious anemia is a type of megaloblastic anemia. Understand the treatment on page 353. A fecal occult blood test. Read more on page 155. Patients should not be taking aspirin prior to undergoing this test. Major side effects of tamoxifen, table 8.6, page 169. Know the nutrition considerations to minimize the risk of cancer on page 154. Know the etiology of aplastic anemia, page 356. Know the characteristics and risk factors for testicular cancer on page 962. Understand the screening guidelines for cervical cancer, table 8.4, page 157.